Welcome to Life Today, Live It with a Purpose. Our purpose is to talk about today a Patoka Valley Regional Healthcare Cooperative, and to talk about what it is and a lot of the goals and what it's going to accomplish. And we have two guests on the show that's going to open it up, and we're going to talk about it. So as we come back after this pause. Welcome back. We've got the Patoka Valley Regional Healthcare Cooperative that we're going to talk about today. On my immediate right is Pete Miller, who's the chair of the board. Pete, glad to have you on today.
Thanks for having us, Dale. We're glad to be here.
Good. And on my far right is Dr. Greg Barclay, who is the chairman of the Provider Network Development Committee. Welcome.
Thank you.
One of the things, Dr. Barclay, that we want to start out with is for the question is that a lot of people have probably read about this in the paper. They probably heard over radio and that. But what is the cooperative?
Well, simply put, Dale, it is a partnership between local employers and healthcare providers. And it's a nonprofit company, organization, and it's basically designed to develop and operate a locally managed healthcare program. And I think the aim is to use local healthcare resources when they're available to meet the healthcare needs of the local community instead of using resources outside the area. That's basically what the cooperative is.
Okay, Pete, when we talk about the cooperative, how did it develop? And you're chair of it, and there's been a lot of work on putting together, hasn't it?
There's been a lot of work, Dale. Going back to late 1993, several employers and I got together at that time with a major concern about the rate of increase of our medical costs as employers. You recall too at that time, Dale, that the federal government and even the state government here in Indiana were looking at medical care programs that could impact us as employers. We had a concern about that, and we believe very strongly that when it comes to those kind of issues, that the local people and the local management here should have a say in how those programs develop. So two things. One is the rate of inflation of our costs, and secondly, our concern about government involvement in our business.
Okay, when we talk about the development of it, I know it took a lot of hours, didn't it?
It sure did.
And you had a lot of people involved in that cooperative.
We did. Going back to early 1994, we were joined in our discussions by representatives from the provider community, basically representatives from the hospitals and the physician community. Those meetings began to occur on a weekly basis. We met every Wednesday morning at 7 o'clock in the morning. And as the meetings progressed, more and more people joined with us in this venture. We had a terrifically complex issue that we needed subcommittees, and we needed the expertise of all the people here in the community to help us get at these issues. We had, at one time, we had 5 subcommittees and a total of 75 people who have volunteered their help to help put this program together. And we're very proud of that effort. We were finally incorporated as a not-for-profit organization in June 1994. and we opened our doors for business in January of this year.
Okay, you talk about developing in that. You probably came across a lot of problems of putting providers, employers, you know, together. That was a big thing too, wasn't it?
It was. When we first looked at this and began to experiment with it, we had an opportunity to visit Bloomington, Indiana, where they had a similar program already in action there. And several physicians, employers, and hospital reps made that visit. Precision Healthcare in Bloomington at that time had a co-op going, and so we got to look at a model there. We were very impressed with it and decided to come back and use that as a model for our proceedings. It was a pleasure for us who manage companies here to sit down with a provider and talk about some of these mutual problems. And we were very, very pleased with the response on the part of the provider in being empathetic with our problem and trying to find consensus to resolve some of these cost issues.
Now, I'm sure that you set goals somewhere along the line when you first sat down.
We sure did.
And those goals, did you have any idea that you would look at today and see those goals as being accomplished, or have they changed?
Well, we did set goals. We set long-term goals as well as short-term goals. The short-term goals were basically to make sure that whatever we do here, that we continue to provide the highest quality care that we can provide to our employees. Secondly, we wanted to move to a single third-party administrator. Right now, every employer in town has an administrator, and they're all different. This creates a situation where you have an infinite number of forms being processed through the provider's offices. It complicates the claims filing process. And so one of the goals was to, in this new effort, this newest initiative, was to have one third-party administrator. We have selected a TPA, if you will, and that's Woods and Grooms, and you'll be hearing more about that later on. A third goal was to establish dialogue with tertiary care providers. Tertiary care providers are hospitals outside our local area who provide specialized care when our local facilities can't handle it. We have begun discussions with hospitals in Evansville, Louisville, and Indianapolis. And the reason for that is because we feel that there's cost shifting that's occurring in these tertiary care hospitals. And by that I mean that when any of our employees go outside the local area for care, we find that the Whirlpools and the General Electrics and the Alcoas and other large companies in these cities have established contracts with hospitals, and these are discounted contracts. So when our employees go into that service area, we believe that the employee as well as our companies are picking up the cost of those discounts. So it puts Du Bois County employees and employer at a terrific disadvantage from a cost standpoint. So we want to get in there and negotiate contracts that can compete with other employers. So we're not writing a check here to Alcoa to help handle their employee costs. So that's another one. And then the last short-term objective is utilization review. We're very committed to intensive utilization review, not only on local cases or the normal cases that come up on a routine basis, but also large case management that will require a lot of attention and managed effort.
Pete, you come from a large company that has a lot of numbers of employees.
Yes.
How do you see this affecting what your company will be on insurance in?
Well, we're hopeful that in the long term that we can contain our cost, our medical cost, at or below the rate of inflation. Right now, our costs are running 4 or 5 times the rate of inflation.
So in other words, through this, not only they'll be able to stay locally, most of them, but also that you can cut cost or be able to save on the cost that you have for medical. Is that right?
Well, we're not necessarily out to cut costs,
okay.
but we are out to contain the rate of inflation of those costs.
Okay.
And I think that's a distinct difference.
So in other words, what we're saying basically here is that, in other words, to be able to contain the cost so that the product you make doesn't have to be reflected in an increase because of the health insurance.
Precisely.
Sure. Well, we've got to take a break right now, and Dr. Barclay, we're going to come back with you and talk to you and the provider network, because that's the important part of it. And Pete will be back to wrap up with you in a little while too. Let's take a break at this point. Yeah. Oh, you're getting better. I would call Washington for you today if you want to talk to somebody.
Okay, you ready now?
Yeah, I'm ready. Welcome back here and talking with the Patoka Valley Regional Healthcare Cooperative. And again, I'm very happy to have 2 people with me on it. Pete Miller, who's the chair of the board, and we spent a little time talking with him on this first portion, but we're going to get back to Dr. Barclay here and define local area.
Well, Dale, the local area as we see it is basically Du Bois County with the surrounding 9 counties. Basically, the ones that encircle Du Bois County, including parts of Gibson and Warwick County, but mainly Martin, Davis, Orange, Crawford, Perry, Spencer. That's basically how we would see this provider network developing.
My understanding is there's about 30% of the people outside of the county come into the health facilities here. So that's the reason you have gone to a larger network area, right?
That's correct. We found that not only a lot of people who live outside of the community come into the community for health care, but a lot of the people who are employed in this community receive health care not necessarily here, but they do want to receive it in their local communities like Washington, Tell City, Paoli, those communities where they have an established relationship with a physician and a hospital. So that's part of the reason we expanded it to that level.
Let's get in a little bit about talking about local managed healthcare. Can you get back into that and talk a little bit more of that?
Sure, sure. I think we're all at this table because we believe that locally managed healthcare is going to make a bigger difference than if we have somebody from outside come in and manage it for us. In fact, the providers in the area, I think the reason they're interested in this is because all of us who deal with insurance companies and employers and patients find that the red tape is impossible. It takes great amounts of time to deal with everybody's insurance company. Everybody has a different insurance plan, different standards. Some diagnoses are covered here, but diagnoses are not covered there. It's a tremendous burden. And we see that by involving ourselves in the co-op, and we can cut out some of that red tape, have a more standardized plan, that makes it easier for everybody. And we also believe that we have great resources in the local area between the hospitals and the physician community that are currently underutilized. There's a considerable amount of services that are seeping out to Evansville, Louisville, Bloomington, Indianapolis, and sometimes those are necessary services, but as Pete was saying, the cost out there is much higher than it is here. And so by redirecting those patients into the local community, we not only benefit the providers, we lower costs, and we keep the health care in the local area, and that's to everybody's benefit. And by doing that, then it's locally managed. And the cooperative, as it develops, is going to hire staff. We already have 2 full-time staff members who will be involved in the day-to-day operations of the organization. And then we have contracted, as Pete said, with an administrator out of Columbus who is going to establish an office here in the local area who will basically process claims and handle the money side of things.
Yeah, we're going to get into that portion in the next week's program, but what is the healthcare network? When you talk about healthcare network, who are you talking about?
Well, right now it's composed of 51 local physicians, 2 local hospitals, and our plan is to involve 3 other hospitals as time goes by. We're looking right now at Perry County Hospital and Davis County Hospital. We aren't sure yet what's going to happen with Orange County Hospital since they are also within our network. As we involve those local hospitals, I think that many of the local physicians who want to, of course, use their local hospital are going to then see the benefit to being involved. We also have 7 chiropractors, 2 podiatrists, 1 optometrist, and several ancillary providers, physical therapists, mental health counselors, and so forth. In addition to that, we are, as Pete said, developing what's called a tertiary care network, which are providers outside of our defined service area, basically in the Evansville, Louisville, and Indianapolis markets, where we can then pick them and contract with them to obtain discounts for services, which puts us at the level of Whirlpool and various other companies so that we get the same discount they get. That's basically where we're at this point.
Okay. Is the network established right now?
Well, the local network is. We are in the process of finalizing contracts with the tertiary care network.
So in other words, it's set up that it can right now go online as when you set up January the 1st, and everybody will be in the same operation then, right? Well,
essentially, we are online. Several companies and their employees are already involved, and these providers are all involved. It's still up to the larger companies to design their benefit packages for their employees. Whereas the smaller companies and self-insured, self-employed people in the area, we're talking about establishing sort of a sub-co-op for them,
right,
which they'll function as a group, basically, to get various group rates and group benefits.
What about services that can't be provided locally? You talked about tertiary and that. Is that all in place now that it can proceed to get services that you can't provide here locally?
Well, what we are doing at this point is targeting hospitals and various medical specialists. For example, allergists. We don't have an allergist in the area. So we need to go out and find some allergists who are willing to contract for services. We aren't to that point yet. I think in a case-by-case basis, as cases come up, right now the co-op is basically sending them to wherever they would normally go. A physician would refer them, and we would go ahead and work directly with them. But our hope is to have a contract.
Okay. How are you going to impact cost with this setup then?
Well, I think that we're going to see a significant impact in costs. For one, the data that we've reviewed when we were first establishing the provider network clearly showed that Du Bois County and the surrounding area, the hospitals and the providers are all low-cost providers compared to the larger cities. So for one, if we rein in healthcare back into the local area, currently the healthcare that is seeping out, that will impact cost considerably. Secondly, all the physicians and providers have signed contracts which then obligate them to a certain rate schedule which they cannot raise for a certain period of time, and it's subject to approval of the co-op. That's another one, and I think, as Pete said, utilization review is the third. Healthcare is changing, and even though this is done elsewhere, people in this area are still somewhat unfamiliar with that notion. And what it basically entails is limiting the choices, essentially, that patients have in deciding their own health care, if you will. Meaning they cannot go to see 4 different specialists and shop around. That they cannot just go to the emergency room for health care when they can go get it for non-emergency conditions. That is something that, if it is effectively managed and patients are directed to key specialists or key primary care physicians instead of to the emergency rooms, or instead of going to primary care physicians in Evansville, for example, you can go to a pediatrician down there. We have 5, 6 pediatricians up here, all of whom are board certified. There is no need for those people to be going down there. That makes us stand back and look at our own values and some of our own prejudices too, and that's going to be hard.
I see one of the savings will be in the amount of paperwork and all it takes to file all these papers out to the insurance, to whoever, and then back that whole thing back up. I see that as a cost savings in that too.
Absolutely. We're looking down the road towards electronic submission of claims, so that basically we exchange data through the phone lines instead of filling out lots of paper and pencil claims. That's the way the industry is going, and we're already being required to do that by Medicare and Medicaid. And so logic would dictate that we should do this also, and we're developing that. And to then be able to exchange data with just one third-party administrator instead of 40 or 50 is going to save a lot.
Sure is.
And as providers have to hire fewer staff to do all the clerical and administrative requirements, then that cost is going to be passed on to the provider and to the patients and the employers.
Well, we've had to take a break again. I appreciate it, Dr. Barclay, and appreciate the fact is that you have brought out a lot of information. We're going to take a break at this, and then we're going to be back to wrap up this portion of the program here after. Welcome back. We got about a minute here, Pete. Would you just sort of wrap up about the cooperative and so that people will know what it's really about?
Sure. Number one, everyone should know that this is a locally controlled initiative. Up to this point, it's been a group of volunteers who have come forward recognizing mutual problems and trying to get at some mutual solutions to those problems. We think we've made great progress. Also, people should understand that this is a not-for-profit organization. It was organized in the state of Indiana under those requirements and will continue to operate that way. We're very pleased with the progress that we have to date, and we look forward to even more improvements in the healthcare delivery system here in Du Bois County and surrounding counties in the future.
Good. I want to thank you very much, Pete Miller, who is the chair of the board of the Patoka Valley Regional Healthcare Cooperative, and Dr. Gregory Barclay, who is the chair of the Provider Network Development. And both of you got a big task, and a lot of you have already accomplished your task, and yours is still being developed. And I know the board's going to do a good job, Pete, and your network here. Thank you for joining us today, and we appreciate the fact that you have joined us on Life Today. Stay tuned for next week when we're going to talk more on this Patoka Valley Regional Healthcare Cooperative. Thank you for joining us.